Hey, what's up, everyone? Welcome to another, I guess you call it a weekly, possibly update on the coronavirus. I am a little bit tired right now, I'll be honest. So I did write some notes down because I don't want to just, there's like so many different layers to this. And I know the average duration time for this video is about 5 minutes. And I know this is probably going to go past 5 minutes, but there's just a lot of different layers and a lot of issues that I wanted to talk about as more unfolds. So real quick, right off the bat, let's go with the numbers. Worldwide, as of right now, March 22nd, there are 335,627 cases, 14,612 deaths, with a mortality rate of 4.3%. I am a little bit surprised. In previous videos, I had mentioned, well, I don't know if I mentioned, but in my mind at least, I wasn't sure if it was if the global deaths was going to exceed 10,000. It's at 14,000, and Italy's getting hit pretty hard. So it's a little bit shocking. The 4.3% mortality. Do I think it's going to go up or down? The overall of that is still a little bit of a question mark. I'm not 100% sure. Let's go with the good old United States of America, where I'm from, when the majority of people watching my videos. 32,783 cases, 416 deaths, with a mortality rate of a 1.2%. I stand corrected. If you could watch my other previous videos, I predicted that the mortality rate would be below 1.5, and I'm actually surprised that it's already down to 1.2, which is awesome. And when it's all said and done, I am very confident. You could use this as proof. Maybe I'll be right, maybe I'll be wrong, but I'm very confident that after it's all said and done, at least in the United States, the mortality rate is going to be less than 1% when it's all said and done. So the media still wants to scare you, and I'm going to get into that in one quick second. It's, of course, I don't take death lightly, but it's not as dire as they make it out to be. So, anyways, the other good news is that of the remaining active cases, 98% of the cases are mild. So that mortality rate is even going to go lower, lower, and lower. The other thing I looked up was of the 50 states in the United States, 43 of the 50 states have less than 10 deaths. So, you know, take that information to the head. And I'm going to go more specifically. I don't know if anyone cares about this, but there's a couple of people in my probably watch my video that are from California. That's where I'm from. And there's 1,555 cases, 29 deaths, with a mortality of 1.8. So in California, we're on a shelter-in-place / minor lockdown. It's at 1.8. I think when it's all said and done, that's also going to stay in the ones. I don't know if it's going to drop below 1, but it'll probably be about 1.5 or even less. So let's go talk about a few points. I want to talk about a few things. One is the media. So the media, they're supposed to be impartial, but I don't live in a fantasy world. They often are not, especially mainstream media. And that's pretty unfortunate. I don't think journalists sign a oath. Maybe they do. I wasn't a communication major, but anyway, the media is out to make money. It's kind of like YouTube, right? I'm sure you guys know what the term clickbait means. It means to kind of entice you to watch the video. Why do YouTubers make clickbait videos? Well, maybe they're seeking attention, which is probably true, but also a lot of it is what? Monetization. It's money driven. The more people that watch your video, the higher retention rate. The higher the retention rate, more clicks equals more money in your pocket. So a lot of assholes out there will do it. Check any one of my 1,300 plus videos, and I challenge you. I can't really find too much clickbait. Maybe there's one or two by accident, but it's not blatant. But this is not about me. This is about the mainstream media. The other thing I want to say is most journalists and the media is to the left. They're Democrats. Sorry, there's a helicopter. Hopefully you don't hear that. Take what you want with that. I'm not a conspiracy theorist, but to think that all journalists don't have ulterior motives is what am I saying? I'm losing my train of thought. Naive. There you go. The majority are Democrats. Trump's a Republican. Like I said, my last election, I didn't vote for Hillary. I didn't vote for Trump. So I'm gonna leave it at that. I vote for Gary Johnson. So take what you want with that. If some people think they're trying to use this to drive him out. So anyway, yeah, with the media, you just want to be a little bit wary. So that's where I'm trying to give out that information. Another thing I want to say is, yeah, even in California, before they did this 3-week lockdown, which I'm finishing the first week, they had stated, oh, in my county, the number of deaths have doubled, and it's like, yeah, you don't take deaths, you know, you don't take them lightly, nonchalantly, but they kind of like glossed over the on the numbers, and I'm all about a numbers guy. So they said it doubled, but they didn't specifically say. So was it from 100 to 200? Is it 500 to 1,000? What is it? But it doubled, right? It doubled. Well, no, it went from 2 to 4 in the entire state of California, and California is huge. All right, but they didn't want to say it. They just said it doubled. Oh my God, it doubled! It doubled! It doubled! People start freaking out, right? Start buying the 6 months of toilet paper. That's what I'm saying. The media, the way they put the headline, they spin it and give out misinformation. I have no respect for that. So try to use your brain. All right. You don't have to agree with everything I say. Take the information I get, take what you want with it. But at least I don't have ulterior motives with it. The other thing the other issue that I want to talk about, because I know this is very multifaceted, is the lack of PPEs, protective personal equipment for frontline workers, in particular, people that work in healthcare or the medical field, such as myself. And there was a group that I got invited to, and I'm not into it. I'm not gonna join these Facebook groups. And sorry, I'm itching. I will wash my hands. These Facebook groups, and they're run by nurses, I think, and these workers are very worried about not having the proper masks and protective gear to help treat these potential people with coronavirus, because we have a shortage. I think I had heard that, you know, this is another issue. People think that we're too reliant on China, because I think they make the majority of the masks. We have too much self-reliance on China, so that's something that we need to tackle in the future. And I think there was one guy, Michael Osterholm or something, he was on the Joe Rogan, and he stated that if they had made enough N95s to cover, I think it was in the entire nation, or at least the majority of healthcare workers, it would cost less than one aircraft carrier. So we've been warned, but the government kind of dropped the ball. They didn't have enough N95s, because if everyone had an N95, I think this would get nipped in the bud much quicker. There's just a lot of layers to it. So anyway, talking about this lack of personal protective equipment, a lot of workers they want hazard pay. They're pissed off, and they just feel like they're not being supported. I've only had about 24 hours to think about this, and I've just been really tired. And this is like right in my backyard, because I work in the healthcare medical field, as you know. I'm not sure about the hazard pay. Of course, I'll take any extra pay. Shoot, I'll take extra few dollars. But when you work for a hospital, or you're a fireman, or you're a police officer, especially if I work for the county, I'm a public servant, and that's kind of what you signed up for. So to complain about it and ask for this, ask for that, I haven't heard some people saying, oh, well, I'm a frontline worker at the hospital, I'm a nurse, so I deserve to have special hours when I go out grocery shopping. I'm not really sure how I feel about that. I think a lot of people are going off emotion and not being objective. I'll probably talk more about that in the future, but the lack of equipment, yes, you do want to have protective equipment, but like at my hospital, what they're doing is we're getting monitored every day. We're getting our body temperature checked every day, and if we have any like a dry cough or a fever, they're going to send us home. They're doing that, and they're pre-screening patients that come in, but luckily we have enough protective gear. So that's another issue that a lot of people are kind of pissed off about. I don't know how you feel about that. The other Well, maybe last 2 points real quick. Let's see, how do I put this? Regarding the effect it has on our U.S. economy, there are some people that are getting angry at others for maybe not following the potential rules about going outside, social distancing. They're getting kind of upset and they're saying, "Why are you being so selfish?" There was someone on my Facebook who stated that they noticed. I think it was a gardener, and he noticed that some of these gardeners were working and they weren't on the essential list to work, and they were getting kind of pissed off. And I wanted to give my 2 cents on this. I think it's not that simple, especially when if you're the one criticizing someone else and you're still able to have a paycheck and go to work during these times, because there's a lot of people right now that, and let me know if you guys and gals are affected by this. There's a lot of guys and gals out there in society that are taking a big financial hit, not just with their 401ks, but they are they don't have work, they can't work, and that's very unfortunate. And to be judgmental and to make someone decide, should I support my family, my spouse, my kids, or should I not work and be extra paranoid for the betterment of society, when, like I said, the mortality rate is 1.2% and going down as we speak, and if you're not even in that high risk category. I think that's kind of that to me is short-sighted and a dick move. Who am I? It's not, who are you to tell someone else that you want to put the betterment of the coronavirus over someone who could lose their house, could not pay rent, and be on the streets themselves. I don't think anybody would do that in their right minds. And to judge them, I just don't, that doesn't make sense. I think everyone in their right mind is going to put their own family and their loved ones first. Now, of course, if the gardener comes or something and there's like 50 people outside, or I don't know, just a bad example, but if someone's doing something really reckless, but I mean, someone gardening, they usually it's like one or two gardeners, and that's no different than me going outside and trimming my hedges and watering the plants. I mean, you're keeping distance. I have a gardener. He comes. It's one thing that I don't do because I'm just so busy. My gardener comes once every 2 weeks, and I don't even see the guy. He just comes, boom, 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 he's done. I'm not even close to the guy, so why don't you just leave the guy alone? People on their high horse. The other thing I want to say about people on the high horse is, I understand the social distancing. You want to do this, but there's other people that they look down upon you if you're not following the rules to the T. Here's a disclaimer, okay? When all this boils over and it's finished, right? And then next year hits, and or everything's back to normal, maybe within 3 months, 6 months. But let's just clean slate it for 2021. This is all gonna pass, and the next year's gonna hit. And I bet the average amount of deaths for the regular flu that's not going to be covered by the media, it's going to be comparable. I don't know if it's going to be globally comparable, but there's going to be a lot of deaths. But because the media is not covering it, people are just going to go back to their lives, right? They're going to go to work, go to concerts, do that, which is fine. You want to move on with life. But those same people that are badgering others for not following the rules to the T, and they're being brainwashed by the media, those same people the following year are still technically putting at risk people that can get the flu, older people, because I don't care what you want to call it. You want to call it the coronavirus, I don't care what year, 5 years, 10 years down the road, every year people die from the flu, and older people with suppressed immune systems are always at risk. But these same people next year, they're gonna be walking around coughing, not washing their hands, getting sloppy again. I challenge you. If anyone badgers you about that, and you're not following rules to the T, wait till next year. See how how they're behaving, and then call them out on it and say, hey, I thought you were the one that was preaching social distancing and to the T. Why don't you, well, how come you're not following it to the T? The person will say, well, coronavirus, it's stopped, it's done, it's done. And then you give them the numbers and be like, okay, but this year the flu has this amount of deaths, boom, boom, boom. How come you're, I wasn't 100% gung ho on it, but you were. So why are you being a hypocrite now? It's to me, it just doesn't make sense. All right, 15 minutes. I don't know if you guys got this far, but I appreciate it. I know the ones that did. Hopefully, you're still hanging in there. Hopefully I didn't. Oh, the last thing I want to talk about is like letting the fear cloud your judgment versus taking calculated risks, and to also talk about unintended consequences and how I would handle the this coronavirus, and my overall thoughts before I depart. So let's talk about unintended consequences. You have good intent on how you want to handle this, but there's unintended consequences. That Michael Osterholm guy on Joe Rogan, he's a specialist for like Center for Disease. I don't think he works for the CDC, but it works for something else. I forgot. Anyway, he said something along the lines of 38% of nurses have at least one child or more, and that's just nurses. We're not even talking about just medical workers in general, and this affects me because this Wednesday I need to take a day off to care for. I don't have childcare needs, so what's happening is by closing so many daycares and closing all these schools, there's a lot of people, a lot of frontline workers that have to take time off from work to attend to their kids, which you're going to put your kids first. But when you do that and you get all these people away from work, I got to be gone on Wednesday. What happens? You get less people to be at work helping people that are in serious condition that have the coronavirus. So you got to find that balancing act. And I believe America's done has curtailed, the this virus with the social distancing and you know canceling concerts and big events. I'm 100% for that, but I don't know if it was handled 100% correctly with the balance. I mean, with me, I kind of feel like they should be quarantining very aggressively the high risk patients, and then not purposely allow people just to walk around and stuff. But you should still do the social distancing. But if the virus were to play out, I think the majority of people that get the amount of that get the coronavirus, excuse me, they would recover anyway. And then when after you get the virus and recover, you develop immunity. Only then, when the majority of society does develop immunity, then when that occurs, then the high risk patients, you could take them out of aggressive quarantine. And then I think by doing that, you will not decimate the U.S. economy. There'd be more people working and not shutting things down as much. That's definitely how I feel. Last but not least, some people will say with that argument, well, when you do that and too many people get sick, even though they might not die, it's gonna cause a lot of people to get the virus at once, and it's going to cripple our healthcare system. Too many sick people. My argument to that is the people that do get the coronavirus, it's mild, and what you can do is you can just have a strict protocol, and you could just deny these people to come in while just the high risk patients are being quarantined. Yes, you're going to get a lot of that. Sucks. There's going to be a lot of people that have, are sick and they can't get medical care. But by doing that, you won't sacrifice too much of the medical resources. All right, so that's pretty much it. We're at 20 minutes. I'm really sorry if I just got so long. There's a lot going on. I got to get my baby right now. She just woke up a couple minutes ago, I think. And thanks for watching 20 minutes. And there's just a lot going on. I don't think the future videos will be this long, but that's it. Thanks for watching. Let me know. You want to talk about however you feel, and that's it. I'll talk to you later. Bye.